Well, I want to thank you all for joining me this evening. I'm sorry we're getting a delayed start. We had some technical difficulties. But anyways, you guys probably all saw this ad in the newspaper or online asking, is that pain in your leg muscle serious? Well, in order to answer this question, we need to spend a little bit of time talking about the peripheral vascular system, as well as diseases that involve the peripheral vascular system. I'll spend a little bit of time talking about the diagnosis and treatment. However, that's not 100% necessary to answer the question, is that pain in your leg muscle serious? And then finally, I'm going to talk a little bit about the association of stroke and heart attack with peripheral vascular disease. So the peripheral vascular system had been named by a cardiologist because it basically involves all of the blood vessels excluding the heart. So it involved the blood vessels going to the head and the neck, the arms, the legs, the intestines, the kidneys. Now, this is a fairly extensive list of all the diseases that can involve the vascular system. By far and large, the most common cause would be atherosclerosis or fibrofatty plaque buildup. And most of my talk is going to be dedicated to this particular disease process. I did want to point out a couple other diseases just more of interest. The one down here, iliac endofibrosis of athletes. So in Boulder, we definitely have more than our fair share of athletes. And this disease can be seen in healthy bicyclists and healthy runners. And it's due to repetitive flexion and extension of the iliac blood vessels when the hip flexes and can lead to fibrosis and scarring. The one above it, ergot toxicity, is kind of more of historical interest, but there's a fungus that will grow on rye bread, and it will produce ergot alkaloid, which is a toxin, and that toxin can cause vasospasm, which results in burning hands and feet. It was thought that the Salem witch trials were actually triggered by an ergot toxicity. So here's a picture of a normal artery above, and we'll see that there's typically 3 layers. There's the intima, which is marked by this letter I, and that's kind of like a layer of skin that lines the blood vessel. And then we have the media, which is marked by M, and that's a muscular layer which expands and contracts to regulate blood flow to an organ bed. And then we have an outer layer, which is kind of this pinkish color, and that is the adventitia, and it predominantly supports the blood vessel with nutrients. If we look at the bottom picture, this is a picture of a diseased artery. And we'll see that the lumen is significantly narrowed, which would result in limitation in blood flow. We'll also see that there's cholesterol buildup, which is here. We can see calcium deposition, and we can see fibrous tissue. So the cholesterol, the calcium, and the fibrous tissue can build up in this intimal layer, which will in turn limit the blood vessel and cause problems. So basically, the traditional view of atherosclerosis is it's like rust in a pipe. So when your pipe gets rusted or corroded, you don't have enough water pressure to take a shower, or you aren't going to have enough water pressure to wash your hands. Well, when the heart arteries become restricted or narrowed, if it involves the neck arteries, you can get a stroke. If it involves the heart arteries, you can get a heart attack. And if it involves the arteries to the arms or legs, you can get a condition called claudication, which is really what we're going to talk about this evening. Now, this is the classic definition of claudication, but it involves basically 3 main points. 1, you aren't going to have pain at rest. 2, when you exert yourself, you will get pain that will tell you to stop doing what you're doing and take a rest. And then 3, that pain will typically go away within about 10 minutes of rest. Now, the symptoms you may get will be different depending on the location where that blockage is. So if the blockage is high up in the leg arteries, we may experience buttock pain. If the blockage is a little bit further down, we may get thigh pain. And if it's a little bit further down, say in the thigh, we'd get calf pain. And if the blockage is in the calf, we would end up with foot pain. Now here are 4 conditions that will result in leg pain and can often be confused with claudication or vascular disease, but are completely unrelated to vascular disease. So the first one is pseudoclaudication, and that is where we pinch the spinal cord and cause nerve pain that is referred into the legs. Now this is often felt when people are in an upright position, but when they flex or bend over, that pain goes away. So you'll hear somebody say, gosh, I got this pain in my legs, but as soon as I get on my recumbent bike and I pedal, that pain goes away and I can do great. Or somebody goes to Costco and kind of spreads out over the shopping cart and can walk forever without pain, but as soon as they're standing, they're having pain. That's called pseudoclaudication or light claudication, but is due to a nerve pinching, not vascular disease. Now, nocturnal leg cramps, that's very common for people to get those. I unfortunately had one last night myself, and that is also not related to vascular disease. So what happens with nocturnal leg cramps is, for whatever reason, that nerve ending releases a chemical which tells the muscle to contract without our wanting it to, and we get that leg cramp. Eventually, that chemical will be reabsorbed and the leg cramp will go away. Calf pressure and tightness, this one can definitely be confused with peripheral vascular disease and claudication, but is not related to that necessarily. So people who exercise spend a fair amount of time exercising, you can sometimes get pressure building up in those muscle groups which are constrained by what we call compartments, and that can cause some pressure or tightness. This would not necessarily come on with exertion, go away with rest. This would be kind of present most of the time, meaning at rest, with exertion, and after. And then the fourth one would be arthritis, and that's actually pain in the joints. So if we're having pain in our knees or our hips, that is arthritis. That is not going to be peripheral vascular disease. I'm going to skip this slide and we'll come back to it a little bit later. So there are a variety of different tests we can use to diagnose peripheral vascular disease. One of the easiest tests to do is what we call an ankle brachial index. We can do this in our office. It's also done at those lifeline screenings that will come to various areas. But basically what you do is you take a blood pressure in the arm and you take a blood pressure in the leg and you make a ratio. So here we have the ankle blood pressure over the arm blood pressure or brachial blood pressure. Now typically the blood pressure in the legs should be slightly higher than the blood pressure in the arms because the weight of blood between the arms and the legs results in a higher pressure. So this number should be 1 or slightly higher than 1. If we see that this number is significantly less than 1, like 0.5 or 0.25, that would indicate that we have severe limitation of blood flow into the legs. The carotid arteries, we can look at those because they're very close to the surface, so we can use an ultrasound and we can take a look at those arteries and look for disease. We can also use the Doppler principle to kind of put the degree of narrowing into one of 3 categories, which would be mild, moderate, or severe. In this slide, you can kind of see a picture of a diseased artery on the right, where the orange, which is the blood, is kind of narrowed or pinched, and they kind of pointed out the plaque for you. The one on the left is a normal looking carotid artery. The differentiation in color that you see is due to flow. We can also use CT scans or MRI scans to image the blood vessels, and we get beautiful images that look something like this. Now the one on the right is a diseased image, and there we go. So the one on the left here, this is normal. We can see the kidneys. We can see the blood coming down the aorta, going into the right leg and into the left leg, and kind of going down and filling up all of these branches. So this is exactly what we want to see when we take pictures of those leg arteries. The picture on the right is a heavily diseased picture. And here again, we can still see the kidneys here and here, but the aorta has a lot of calcium in it, which is showing up as this very bright white. So that's actually calcium deposition in there. And then the contrast is showing up as kind of more of a grayscale. Now my pointer keeps coming out, but basically if we come down into this right leg, we can see that that blood vessel is essentially occluded here, where it should be open like this. And then the blood eventually does make its way down in here to the popliteal artery just behind the knee and kind of continues down. But this would be an example of diseased and normal. We can also do angiograms to take a look at the blood vessels. This particular picture is somebody doing a coronary angiogram, but we can certainly use the same equipment to take pictures of the blood vessels and the legs, and this would be a picture from an angiogram. And we can see the aorta here. We're coming down into the left leg here, and then we have the blood vessel coming into the right leg, and we can see that it is significantly diseased in this section here. So the primary treatment for peripheral vascular disease is risk factor reduction, medications, exercise. Percutaneous coronary intervention is kind of a group term that we use to refer to all ways of fixing blood vessels through a sheath placed in the leg. And then we also have surgery. So here's the slide that we saw a little bit earlier showing all the risk factors. And you can see that there's some risk factors here that are modifiable. So if we have high blood pressure, we can treat it. If we have high cholesterol, we can treat it. If we're smoking, we can stop. But some of these risk factors we unfortunately don't have control over, and that would include advanced age and bad genes. In terms of the risk factors for peripheral vascular disease, the single most important one to get under control is smoking. If we quit smoking, it can slow that progression of peripheral vascular disease and is extremely important to focus on. Here's a list of a variety of medications that have been used to treat peripheral vascular disease. And we got aspirin and Plavix. These are basically blood thinners, which will thin out the blood. Cilostazol is a medication that will thin the blood like aspirin and Plavix, but it also is a vasodilator, and it dilates those blood vessels and can improve blood flow. Pentoxifylline is a medication that's supposed to decrease the viscosity of blood and allow it to go through those blockages or narrowings a little bit better. The data for it is not terribly good, and we typically prefer cilostazol if tolerated. Then you can see I also have ginkgo biloba and chelation therapy on here. There's a couple initial observational studies that suggested ginkgo biloba may help manage symptoms of peripheral vascular disease, but in the subsequent trials, it really did not pan out, so this is not a useful medicine. Chelation therapy, kind of in that slide I showed you earlier, we can see that calcium deposition in the diseased artery, so you can use chelation therapies to kind of absorb the calcium. And so there's some thought that if we use chelation treatments of sodium meditate, we can get the calcium out of those blockages and shrink the size of the blockages. But in actuality, it doesn't work and is not useful. In this slide, I'm talking about exercise. There's kind of an interesting cartoon on the right. It says it powers the TV, and I'm hoping he'll lose 10 pounds during the World Series alone. So I did put a couple jokes here, but exercise is definitely not a joke. Exercise is extremely important when we're managing peripheral vascular disease. It does a couple different things. One is it can cause collateral blood vessels to grow. So collateral blood vessels are blood vessels that will work their way around the blockage. They may not be as big as the initial blood vessel, but we can certainly get blood flow around the blockage and improve symptoms. So if we exercise into that pain, it will cause new blood vessels to grow, which will help decrease the pain and allow you to exercise more. In addition, it also improves the efficiency of the muscles at extracting oxygen and also helps improve symptoms. So exercise is extremely important for this peripheral vascular disease. Now, if you had blockages in the heart arteries and you got symptoms, we would definitely tell you to stop exercising and rest and make those symptoms go away. But when we're talking about peripheral vascular disease, it's no pain, no gain. You want to exercise, you want to get the pain and help grow those new blood vessels. So here's a slide showing a variety of different techniques for opening blocked heart arteries. Up here in the top left, we can see there's a wire that's been placed down the blood vessel, and we can see a balloon squeezing this cholesterol plaque out of the way and opening up the blood vessel. So that we would call angioplasty. We will often use the stents that are just below the angioplasty balloon to kind of serve as a strut or scaffold to hold that blood vessel open after we do the balloon inflation. And then on the right, we can see a special catheter that we're using to actually extract the cholesterol plaque from the artery. Now, this is typically my favorite section of my talk, but unfortunately, my videos are not coming through. Evidently, they need to be stored on the computer in order to play with PowerPoint. But I'm going to go back. So this was a picture that we took of the aorta extending down into the right and left legs. If we kind of advance into here, this is that same area, but you can't see the blood vessels. But you can see a catheter kind of extending up the left leg into the aorta. We got another catheter going up the right leg into the aorta. And then here we can see two balloons being inflated to squeeze that blockage out of the way. And then this would be my favorite part, showing a nice, beautiful blood flow down into the legs, but unfortunately that's not coming through for you. And then this is a similar one where I ended up fixing a leg artery that was heavily diseased. You can definitely see the artery in this case because of all the calcium deposition in it, so it's highlighting with the x-ray just like the bone does. But unfortunately I can't show you what that blood vessel looks like or the after. But basically we use those balloon techniques, the stent techniques, and the atherectomy techniques to kind of open up those blood vessels and make them look really good. But in order to do those, we have to go through the blockage, and we can't always get through the blockage. Occasionally the blood vessel's totally closed, and it's totally closed for a long distance, and our stent and balloon techniques just don't work for that. And so we can do surgery. And so here's kind of more of a cartoon graphic of it, and they're kind of highlighting the leg artery in the left leg, and we can see that there's a blockage here. And instead of trying to go through that blockage, they basically tied a bypass graft and went around the blockage. And so we call that bypass surgery and going around the blockage, and that is a good technique for fixing those as well. And then this was a picture of somebody who had a bypass, but it then re-narrowed and we had to open it up with stents and balloons, and so we ended up using kind of both techniques. But in this picture, you can kind of see here's the ankle, that's the tibia and the fibula down in the foot, and there's an artery that came down. These are the surgical clips from the bypass, and there's a tight blockage right here that we ended up ballooning and making it look beautiful. But this is probably the single most important slide of the talk, which is, why is that pain in your leg serious? And the reason why it is serious, not necessarily because it causes symptoms, maybe makes you hurt when you walk. It's serious because it is a warning sign for stroke and heart attack. Okay? So 20% of people with claudication will have a stroke or a heart attack. 15 to 30% of people with that will end up having a heart attack or death. And so when we ask the question, is that pain in your leg muscle serious? This is why it's serious, because it is a marker of coronary artery disease. It's a marker of stroke. And that kind of makes sense because a lot of the risk factors are very similar. And so if you have symptoms that are not present at rest, come on with exertion, and then go away when you rest, that's concerning for claudication. We definitely want to do one of these tests to look for disease, and if it's there, we definitely want to manage it aggressively to try to prevent stroke and heart attack in the future. I'm hoping that I saved enough time so we can get some questions in. I know we started late, and I appreciate everybody's patience.
Thank you so much. If you had any other further explanation of any of that, we have about 5 minutes, but because of the technical difficulties, we will not be able to take any questions from our audience tonight.
Okay.
Is there anything else that you would like to spend just 5 more minutes on here? If not, we can wrap it up.
Okay. I was hoping to have questions. They're always the most fun.
Yeah.
And it's always a little hard when you're doing the live stream because you don't get to see what are people picking up, what you're asking or not picking up.
That's right. We'll have
Yeah.
you back, and we'll have more questions the next time you're here.
I think that would be great.
All right. Well,
All
we'll
right.
go ahead and wrap it up for tonight then.
Okay.
Thank you very much for the information and
Yeah.
for your patience. And audience, we appreciate your patience tonight. And we've come to the end of our time, and a recording of tonight's lecture is available at bch.org/livestream. You'll receive a post-lecture survey by email. Please take a minute to fill this out. And please visit bch.org for info on the COVID-19 vaccine. Again, thank you very much for your patience, and we hope you enjoyed the lecture tonight. Thank you.